Testing, testing. Okay, so today what we'll be looking at is blood vessels and blood circulation. All right, so this is something that's very important. And let's start the slideshow and see what is going on. Okay, so blood vessels, blood circulation, this is something that is very important because blood vessels, they carry all of the blood within the body itself, carrying nutrients as we looked at when we looked at the composition of blood and its functions, carrying nutrients to all of the cells throughout the entire body. So therefore these vessels are critically important. And let's have a look at what they do. So in terms of the vascular system, it's a closed system involving the blood vessels and, of course, the four heart chambers, the two atria and the two ventricles. They are associated with the removal or circulation of blood, the blood moving through the heart, and it's pumped out through the major artery, the aorta, and returned via the vena cava superior and inferior ones. So let's have a look at these blood vessels. There are five main types of blood vessels, namely arteries, and the smaller arteries are known as arterioles, veins, the smaller veins are known as venules. Very importantly, the intermediary between the arterioles and the venules are the capillaries. And the reason why the capillaries are the intermediaries is because they are so thin. They are one cell thick. So therefore they facilitate the exchange not only of the fluids, but also of gases in and out of the vasculature. This becomes very important when we'll be looking at respiration to see how gases are exchanged within the lungs themselves. Let's have a look at the blood circuits. Now, the blood circuits refers to the movement of blood throughout the entire body. There are two circuits, the pulmonary and the systemic circuit. The pulmonary circuit refers to the removal of blood within the heart to the lungs for oxygenation and return once again to the heart itself. The systemic refers to the movement of blood throughout the entire body, i.e. the system. So therefore the blood that is now oxygen rich is now oxygen rich because the hemoglobin, the 2 alpha 2 beta subunits, with the heme moiety or the heme ion, which forms an integral part of it, which is why it's critical that you do consume iron in your diet. Lack of it could cause a type of anemia because the carrying capacity of the blood is then reduced significantly. So very important in terms of the blood as it carries the oxygen throughout the entire body via the systemic circuit. Of course, having gotten the oxygen via the pulmonary circuit as it moved towards the lungs themselves. Let's have a look at that. So here what we are seeing in terms of the movement of blood going to the lungs, and very importantly, and we'll see this when we actually look at the lungs, what is happening in the lungs, exchange only occurs via the capillaries, these one cell thick parts of the circulatory system. Very important because the membrane or the outer coating of these vessels, they're one cell thick. Not only are they one cell thick, but they do have gaps between them. And this allows gaseous exchange, which is why at the level of the lungs, you could have gaseous exchange occurring specifically in the alveoli. I wouldn't get into too much detail. You'd look more at that when we are looking at respiration. But just to say, the capillaries, which are found in the alveoli, this is the only part of the lung in which you could have gaseous exchange occurring. Gaseous exchange occurs nowhere else as it relates to the movement of oxygen and CO2, oxygen into from the lungs into the red blood cells, CO2 of course moving in the opposite direction, and then of course CO2 being exhaled via a negative pressure system. All right, so what are the two blood circuits? As we mentioned, right, the pulmonary and systemic ones. Let's go forward. So vessel structure. The vessels themselves, they contain three tunics or coats: the inner endothelia, the middle or smooth muscle, and then the outer supporting connective tissue. Very important that you have this smooth voluntary muscle which occurs in the middle layer, and this is very important as it comes under control of the autonomic nervous system, or automatic, so therefore we have no true control over it, and this facilitates the movement of blood through these vessels. Let's have a look here. So here, for instance, we are seeing the artery, and what is showing the outer tunic of connective tissue. Here we have a middle tunic of the smooth muscle and an inner tunic of the endothelial cells. So is this smooth muscle contraction, rhythmic contraction, actually assists in the movement of blood throughout the entire systemic system. When we look at veins, one of the things we will notice, this middle tunic here, in terms of the smooth muscle layer, it's a lot thinner. And one of the things that veins do to compensate for this lack of musculature is that they usually align themselves with other muscles, skeletal muscles in the body, such that when these skeletal muscles contract, as is the example, let's say in the calf, when you do have muscles contracting there, gastrocnemius muscle, you do have contraction there, it forces the blood that's coming from the inferior vena cava, it pushes it all the way up. So that's very important, that in terms of getting blood up to the inferior vena cava into the heart, it is facilitated by movement of skeletal muscle, namely the gastrocnemius muscle. Okay, so here we're looking at a cross-section of a vein and artery. Could we tell the difference? Yes, we could. Arteries are generally wider, as we see here. Their lumen is larger than the corresponding vein, and also that smooth muscle layer is thicker. So that's some important differences between arteries and veins. Of course, surrounding the arteries and veins, of course, this is fat or adipose tissue. And the importance here, why do they stain white? Well, the stain is not picked up because most of the fat is actually dissolved by the substances present in the hematoxylin and eosin stain. It actually dissolves all the fat. So there's nothing to stain, so therefore it remains white when you do use the H&E pink stain. All right. Pulmonary arteries carry blood that is low in oxygen. That is true, right? Pulmonary arteries and the pulmonary vein carries blood that is high in oxygen in terms of it returning from the lungs to the heart itself. Okay, so now let's move on and let's just talk a little bit about the systemic arteries. Again, the systemic arteries, this is referring to blood flow away from the heart. The largest of these is, of course, the aorta, the largest artery. This receives blood from the left ventricle and it branches to all of the different types of organs. So the aorta consists of four main parts, and you'll be well placed to actually know them, namely the ascending aorta, the aortic arch, thoracic aorta, and the abdominal aorta. And if we look at this diagram, we will see those aforementioned artery parts which we mentioned there. All right, so you will be wise to actually take note of them in terms of the aorta and its numerous branches. Okay, so this is a question we often get. So, or miss, as the case might be, which arteries and veins do we have to learn? Well, I will tell you the major ones. Which ones are the major ones? Let's have a look. Okay, so when we're looking here, let me use the laser pointer. The vertebral artery, that's an important one. First of all, let's start at the level of the heart. So blood is coming out of the aorta, there's the thoracic aorta. So the heart is usually situated in the mediastinum, a little left of the midline. So it usually is located here. Here you have the thoracic aorta, the brachiocephalic artery. Yes, you would need to know that. Subclavian coming down here, the axillary, brachial, radial, ulnar. Those are the major ones you'll have to know here. Going inferior or downward from the heart, the celiac, renal. This is the testicular artery, inferior mesenteric, common iliac, internal and external iliac, popliteal, this is one right behind the knee, and the geniculate. These are the ones you have to know here. On this side here, the femoral, very importantly, so named because of the bone that lies behind it, the femur. Anterior tibial, the anterior and posterior, so named because one is in front, anterior, posterior is behind. And down here, of course, you have the dorsalis pedis. So these are the ones which you will have to know as it relates to the principal systemic arteries. Okay, so just talking of them in terms of the ascending aorta, the aortic arch, those you'll have to know, pay attention. The branches of the thoracic aorta, you'll have to know those as well. And of course, the branches of the abdominal aorta, left gastric, splenic, and hepatic. Of course, you also need to know these, lumbar, ovarian, and testicular, and or, because either one or the other, renal, suprarenal, supra is above, and then the phrenic arteries. Good. All right, let's move on to the next one. So what are the subdivisions of the aorta, the largest artery? Right, which branch of the aorta divides further into the three arteries? And that one, of course, will be the celiac trunk. Very good if you got it right. If you didn't, I know you'll get it next time. So this is just speaking to the iliac arteries and their subdivision, the internal and external, and of course the femoral, that's the one in front of the femur. You have the popliteal, that's the one that goes behind the knee. The tibial goes down to the tibia, and the dorsalis pedis down to the lower limb. And here are arteries that branch to the arm and head, external and internal carotid. Very important. The subclavial, you have the vertebral and axillary. And in terms of the branching of the brachial, you have the vertebral and axillary in terms of divisions of the subclavian. And the brachial subdivisions of the axillary, you have the brachial artery. And brachial is further subdivided into the radial and ulnar. So named, of course, because of the proximity to the closely related bones, radius and ulnar. Going further, the superficials and the deep veins, you'll be well placed to know those as well. Cephalic, basilic, median cubital. And for the deep veins, femoral and iliac, brachial, jugular veins, and the brachiocephalic vein. So we looked at the main arteries and the main arteries associated with the body itself. Now let's just see if we could go back to the heart, that main pump where it all starts in terms of the movement of the blood into the systemic circuit. You have the superior vena cava, and in terms of movement, of course, to the head, neck, and the upper extremities. The azygos vein goes to the cell wall, and from the inferior vena cava, it goes from the right and left veins, unpaired veins from the spleen and digestive. Very important to note that the vena cava, this is where blood is returned to the heart itself. So this would mean that we are moving on to venation or veins. Let's see if we can have a further look at it. So here, in terms of the ones you should know, the external jugular, brachiocephalic, and they're very similar to the arteries in terms of their names. Superior vena cava. Note the superior location of the superior and inferior vena cava as it relates to the positioning of the heart. Inferior comes from below, superior comes from above. Very important there. Cephalic and basilic going down to the hand itself. Then you have the renal artery. This goes to the kidneys, lumbar, to the vertebral column. Testicular goes to the testicles. Internal and external iliac, femoral, major vein that runs down the leg. Saphenous, here it is. The popliteal runs behind the knee. Tibial, so named because of the proximity to the bone, the tibial bone. All right, So what is the name of the unpaired vein that drains the veins of the chest wall? And that would be not the cephalic or the subclavian, but the azygous vein. Let's talk a bit about the hepatic portal system. Now this is very important because it carries blood from the abdominal organs to the liver. Now remember, when the blood is returning from the systemic circuit, it has to be cleaned before it goes back into before it re-enters the systemic circuit one more time. So in terms of the cleaning system, this is facilitated by the liver in particular. And in terms of the vessels which facilitate them, you have the splenic vein, the superior mesenteric vein, gastric, pancreatic, and inferior mesenteric veins, and the sinusoids. Let's see diagrammatically how this looks. So here we see the blood vessels, namely the veins, as they go through, they're returning from these organs, and before they enter the inferior vena cava, most critically, they have to pass through the liver. So here it is the blood that's coming away from the spleen, from the stomach, from the colon, in terms of from digestion, returning nutrients. Here it is, it has to pass through the liver. And very importantly, one of the things you have to appreciate in terms of organs by mass, the liver is the largest organ by mass. It stretches virtually right across your midsection. Very importantly as well, the microcirculation of the liver is very large, which is why when you're looking at the developing fetus, there's a shunt that actually shunts the blood, oxygen-rich blood and nutrient-rich blood coming from the mother. It shunts it away from the liver, right? And it goes directly to the fetal circulation, bypassing the liver. We'll speak more to that a little bit when we are looking at reproduction. So very importantly, this hepatic portal system, in terms of cleaning up the blood before it returns to the heart to enter the systemic circulation. All right. So in terms of circulation, blood exchange, the oxygen, carbon dioxide, and other substances are generated by the cell. And of course, tissue fluid is the exchange medium. So now let's talk about how is it that capillary exchange is facilitated. The major movement of oxygen, of course, is by diffusion. So oxygen moving from its area of high concentration to low concentration across that membrane of the capillary. And again, it occurs very easily at the level of the lungs. If we're looking at the lungs, specifically at the level of the alveoli, because of the fact that the capillary wall is only one cell thick, and also because there are gaps in the wall. So this facilitates this diffusion of the gases. Oxygen, high in concentration in the lung, moves easily across into the blood. CO2, high in concentration in the blood, moves out of the blood into the oxygen for exhalation. So that's very important. And of course, in terms of maintaining this blood pressure, and by extension, the osmotic pressure is very important in facilitating this diffusion of gases. The blood pressure, it moves material into the tissue fluid, whereas the osmotic pressure, or the tendency of osmosis to occur, it also moves additional material into the capillaries as well. So here, this is showing, of course, the intertwining of the lymphatic vessel with the capillary, which just goes to show in terms of how you could have movement into the lymphatic system. Very important to note as well with the lymphatic is also the repository of cells of the immune system, the lymphocytes, and this is very important in terms of when it comes to maintenance of your body's immune system or fighting off any infection throughout the body. The lymphatic system then becomes very important. Okay, so movement of blood. We mentioned that certain arteries have a smooth muscle layer, very importantly. And what do these smooth muscle layers do? Well, they help with two particular characteristics. Not only the arteries, but the veins have them as well. Two characteristics associated with them. And I would just like to highlight them: vasodilation and vasoconstriction. So vasodilation, of course, this refers to the dilation of the blood vessels. This facilitates more blood flowing through it, more blood carrying heat. So therefore, heated loss is increased because of the fact you have more blood flowing through it. When you're cold, vasoconstriction occurs. Blood vessels in particular, which are close to the skin, what happens is they constrict, less blood flow. Since the blood is a carrier of heat, therefore heat loss via these vessels are diminished significantly. So this is one of the ways that the body accommodates it in terms of facilitating, heat loss through vasodilation and vasoconstriction of veins close to the veins and arteries close to the skin. What is the name for the collection of vessels that carry blood from the abdominal organs to the liver? We just looked at it, and collectively that is known as the hepatic portal system. So here we are looking at the gastrocnemius muscle, and as we mentioned, in terms of returning blood to the heart itself, one of the things that happens is the vein actually is located within the gastrocnemius muscle, such that contraction of these muscles allows or forces the blood up the vein. So the veins themselves, thin-walled, not a lot of smooth muscle present there, as opposed to arteries, which have a thicker muscular wall. So what happens in this case, you could say the veins, to compensate for their lack of musculature, what they do, they locate themselves within a muscle, namely the gastrocnemius, so that when contraction of that muscle occurs, it squeezes on the vein, so then forces the blood up towards the heart. So that's one accommodation there that is made. All right, so we're almost there. In terms of pulse, very important, and I'm sure in your skills training you have looked at pulse, the importance of pulse, and the different things you could detect in terms of pulse. So what pulse is, it relates to ventricular contraction and a wave of increased pressure. It begins at the heart and it travels to the artery. It is influenced by various factors, of course, body size, gender, age, muscular activity, emotion, body temperature, and thyroid secretion. Of course, muscular activity, when we tend to be doing lots of things, we see that our pulse rate goes up. As we get older, as it relates to age, the pulse rate usually goes down, and this could be correlated, there's a correlation between that and muscular activity. As you get older, you become a little more sedentary. So therefore, muscular activity decreases, so therefore pulse rate decreases. In terms of gender, one of the things which has been shown is that men tend to have higher pulse rates than women, and this has a lot to do with stress and how men handle stress. It has been shown that women tend to handle stress a lot better than men, so therefore their pulse rate and by extension their blood pressure is lower. Men tend to internalize and not share a lot. So what does this contribute to is an increased pulse rate because of the fact that the all of the stress is kept in. Body size, this could affect this could affect as well your pulse, depending on your level of fitness, right? So your resting metabolic rate will be lower when you're fit as opposed to when you're not. Right? Emotions play a lot in terms of pulse rate. Again, the secretion of certain hormones, this could affect heart rate and by extension the pulse rate. Body temperature as it relates to pulse rate, yes. In terms of the movement of blood through your vasculature, in terms of wanting to cool down your body via loss of heat through vessels close to the skin, this would increase when you are in a heated environment. So therefore, your pulse rate tends to go up indeed when you are in an environment which is indeed hot. And of course, thyroid secretion, this increases metabolism, and by extension, it will also increase your pulse rate. All right, so blood pressure. This is the force exerted by blood against vessel walls, and it is determined by the heart's output and resistance to blood flow. So very importantly here, and again, here we are seeing the homeostatic mechanism that regulates blood flow. And again, this is a negative feedback mechanism. Only positive feedback mechanisms, which I know of, is one, of course, the release of hormones, which are very important to the squeezing or the contraction of the uterus during childbirth, right? Oxytocin release causes that. And then of course the other one into which is under positive feedback is of course those different chemicals which are associated with blood clotting. All right, so when you have more blood flow, what do? That cascade which is associated with clotting, all the agents, they just continually are released and the concentration goes up in the blood in terms of ensuring that the clot forms. So those are really two which I do know are under positive homeostatic control. Oxytocin regulation and also the clotting mechanism. Those two are under positive control. Okay, so just in terms of a definition, we just want to touch on some. The cardiac output. This refers to the volume of blood pumped out of each ventricle in 1 minute, whereas the heart rate is the beats per minute. Stroke volume is controlled by, of course, the force of contraction. And the things which are known for assisting with the resistance to blood flow, you have the baroreceptors or the pressure receptors in large arteries, elasticity of blood vessels themselves. Yes, the blood vessels contain elastin, and they do have this ability to have a little play with them, as it were. They could extend, but of course, most critically, return to their original size once pressure normalization occurs. Viscosity of blood. The viscosity refers to the thickness of the blood. So of course, if the blood is thinner, it flows much easier through the vessels, which is why when persons do present with certain heart anomalies, such as a myocardial infarction, one of the things they do prescribe is, of course, aspirin, which is a known blood thinner. All right, so that is very important. And they do prescribe as well other blood thinners, which decreases it decreases the viscosity. So in other words, it gets thinner. And this allows a freer flow of blood through the vessels. Blood pressure measurement, and again, you as a nurses, you would have looked at this in your skills class. The pressure is measured in the brachial arm artery using a sphygmomanometer. All right, and of course, you would have done it the quote-unquote old school way in terms of using the stethoscope, listening for the blood flow. And then, of course, the modern way, which is just placing the device around the arm and letting the device do it itself. So the systolic pressure normal is 120/80 in terms of a comparison of systolic to diastolic. Systolic, the squeezing or contraction associated with the heart, whereas the diastolic is the relaxation. All right, so what is the name of the device used to measure blood pressure? That would, of course, be the sphygmomanometer. All right, so it's just like saying fig, another name for a banana, and put an S in front of it. So you get sphig. It's a sphygmomanometer. All right. And that will be the end of the presentation. So what we looked at the vessels associated with blood flow, arteries and veins, the major arteries and veins associated with the systemic blood flow. We looked at those. We also looked at the things which influence the blood flow through the entire cardiovascular system. That is very important. The exchange of gases occurring only at the level of the capillary, that was highlighted. And again, it was mentioned that you will look in greater detail when you look at respiration to see how that is facilitated at the level of the alveoli within the lungs themselves. And again, very importantly, in terms of the blood flow, how do we know that the blood flow is going right? Well, you do have certain things you can measure in terms of the blood pressure, that's one. And of course, most critically, the pulse. We did mention certain things which affect the pulse and by extension, blood pressure as you get older in terms of the body mass index, in terms of your level of fitness, all of these things do affect them. And of course, most critically, how is it measured? You use a sphygmomanometer. That is very critical. Okay, so we'll stop the presentation there. Hope you did enjoy it, and see you at the next presentation. Okay, have a good one. Good day.